You've probably had some recent trauma to your shoulder area, which got you looking into shoulder rotator cuff surgery. Eventually, when ice, exercise, and deep tissue massage is not enough, it's time to consider surgery. Over the span of 2 years, I've had 2 rotator cuff surgeries. Now both shoulders are pain-free, and I thought you might benefit from my experience. I found the experience of 2 shoulder surgeries nothing to fear, but simply an obstacle that can be overcome with patience and preparation. An evaluation by the surgeon is an excellent first step. Be sure that you have total confidence in your surgeon, otherwise get a second opinion. During your appointment, ask the surgeon to recommend a series of physical therapy visits and a local physical therapist. This physical therapist should have flexible hours and be close by, since you will be visiting him for 2 or 3 months. A couple of months working on your pre-surgical shoulder rehabilitation program will pay dividends in the long run with a quicker and smoother post-op recovery. Find time in your daily schedule when you can faithfully perform exercises as directed by your physical therapist. After 2 or 3 months of good pre-surgical program, you will have more confidence in any decision for rotator cuff surgery. Be sure to follow the directions of your physical therapist to avoid further injury. Injured patients who exercise without guidance are at a huge risk for further injuring muscle tissue. Do your cardio. Make it a practice to do some walking, use a stationary bike, or do stair climbing. During your rehab, you won't be as active as you usually were, so moderate your caloric intake to keep from gaining weight. Another part of your pre-op preparation is to practice the skills of common daily tasks with your involved arm in a loop, or simply put your involved arm in your pocket and go through your daily activities. This simulation can be astonishingly revealing, giving you a motivation to develop post-operative skills. Practice sitting down and returning to standing without using your involved arm. Pick up objects off the floor. Start developing some extra hand strength in both hands to help compensate for a loss of the use of your involved shoulder. Practice computer usage without your involved shoulder, keyboard and mouse. Practice dressing where you put on your underwear, a shirt, pants, socks, and shoes. Practice the bathroom activities consisting of hair brushing, hair washing, body washing, shaving, putting on lotions, skin creams, or makeup. Practice brushing your teeth. For personal toilet hygiene, use of toilet paper with only your non-involved arm may only present some difficulties at first, but with practice, it will be easier. With this simulation of daily living, you will quickly discover which extra skills will need development and when you will need a post-operative caregiver to assist you. Patients who use special medical devices or CPAP machines should practice the use of this equipment using only the non-involved hand. Get your home ready to accommodate your needs when using your non-involved hand only. Set up your favorite chair with a table so that you can manage reading, telephone, TV, and lighting. Set up your bed and practice sleeping on your side with your involved arm elevated. Set up your desk and computer to accommodate only your non-involved arm. Get bills paid, as writing may be difficult and unintelligible. Now is also a good time to familiarize yourself with driving with one functioning arm. Set up an indoor recumbent bike for general exercise. Use this preoperative period to prepare easy activities or fun projects that you never seem to get around to doing. You are now ready for your pre-op hospital visit just before your operation. Bring a list of all your current medications and over-the-counter medicines. Take this opportunity to discuss issues and concerns with the anesthesiast and staff. Notify the anesthesiast of previous difficulties with pain medications or pain control. Then, just prior to surgery, get your hair cut and cut your toenails. Now you are as ready as you can be.